It should be one of the most joyous moments in life, the birth of a new baby. But for far too many women in the United States, especially women of color and their families, it's not joy they're experiencing, but heartache, complications, and even death.
When I checked in, they're like, okay, go back home. Everything is fine.
Women like Fantasia Graham.
And I knew, deep down in my heart, everything was not fine because my body was just giving up, in so much pain. I was at my grandma's house and, getting ready for school. I just saw, blood. She was like, go to the hospital, now. When I got there, they did an ultrasound and they told me that they didn't hear a heartbeat.
The nurse pretty much told her, I'm sorry, your baby has passed away.
I felt depressed. I felt sad. I felt hopeless.
Fantasia is one of several women whose experience is featured in this month's National Geographic, shining a light on the risks of giving birth in the United States. Who in particular is being affected the most?
If you're an African-American mother, your risks of dying in childbirth are 3 to 4 times higher than if you're white. African-American women are less believed when they express that they have concerns about their symptoms, particularly around pain.
Despite our advances in medicine, childbirth remains an area fraught with potential danger to mother and baby, even when you can have the best care in the world.
Perfect.
It's perfect.
For tennis pro Serena Williams, complications during childbirth almost proved fatal. Her experience highlighted in the HBO docuseries Being Serena.
I told the nurse I can't breathe. I need a mask. And that my stitches broke. And it was just really hard.
Williams illuminating a stark reality. Obstetric complications do not discriminate based on fame or fortune. A stark reality Mustafa knows all too well. A first-time father to 4-month-old Musin, he beams with pride as he shows off the nursery he and his partner designed.
Everything was Tamesha's idea. The name on the wall, his crib, everything.
But now all of this, just reminders of the life they could have shared.
Musin is going to miss out on having a great mother. That's what hurts so bad about this situation.
His partner, 38-year-old Tamesha Dickey, died during labor. Tell me about Tamesha.
She was just a caring, loving person.
Her pregnancy had been going well. She was not high risk and had been regularly going to her prenatal visits. But during labor, Tamesha began having trouble breathing. Within minutes, she went into cardiac arrest. Doctors performed a bedside emergency C-section to try to save her and the baby. But for Tamesha, it was too late.
Her OB, she came out and told me, said, I'm sorry. And she didn't make it. I broke down. I witnessed her take her last breath in front of me.
She died of an amniotic fluid embolism, an often fatal complication that occurs in 1 out of every 10,000 pregnancies. We don't know why it happens or how to prevent it. Among developed countries, the United States has the highest rate of maternal death. Every year, there are an estimated 60,000 serious obstetric complications and approximately 700 deaths either during or soon after pregnancy. An estimated 60% of those deaths are considered preventable.
In the United States of America in 2018, 75% of the nation's landmass, you might not have access to anybody qualified to deliver your baby. Maternal mortality in this country has been going up for 20 years, and we haven't had the kind of response that you'd expect for something that significant.
So obstetricians like Dr. Shah have made it their mission to find solutions to the cracks in the foundation of care inside the hospital so they can be applied on a national level. Last spring, we spent over 24 hours with him and his team in labor and delivery at Beth Israel Deaconess Medical Center to see how they do things differently. It starts with communication.
Okay.
A moment like this, called the huddle.
She is currently 5 to 6, 80, and -2. We just checked.
Where all the doctors and nurses meet to discuss every patient on the labor floor, so everyone is accountable for everyone's care.
It's been shown across the country to make a really big difference in patient safety.
Any allergies to medication?
Down the hall, Wendy and her husband John have just arrived. In labor with her first baby, Wendy has decided to try to go without an epidural.
Deep breaths, deep breaths.
Something only 10% of women choose. And she's given the time to explore this option. Time, another tenet of Dr. Shah's approach to fixing the system.
Just keep doing what you're doing. Deep breaths.
It's about knowing when to wait and when to act swiftly.
Oh, good.
Eventually, her contractions become more painful.
It's not a cop-out to get an epidural. If it's what you wanted to do, like, we're 100% behind you and supporting you to do that. She gave the order.
4 hours later,
Big push.
There she goes. More. That's it. Hi, little one.
We're gonna have a baby.
Oh my gosh, you do.
but in that moment of joy,
John, would you like to cut the cord?
Wendy is unaware that she has started to lose a lot of blood.
You have a higher than average amount of bleeding right now. We have a resident.
For Dr. Shah, now is the time to act swiftly.
There's two places where you can have a little bit of extra bleeding. One is from the tear and one is from the uterus. So we gave you some medicine to help with the uterus part, and I'm going to do the repair now for the tear. Okay.
She's lost a liter of blood in minutes, which qualifies as a postpartum hemorrhage.
And there was something pumping back there that I think was probably vaginal that we got. So I think we're okay.
Thank you so much. One big family. Yes,
Let's do fist bumps all around.
Thank you very much. Thank you.
While Dr. Shah is working on hospital protocol, Brianna Green is working at the community level to help the most at-risk demographic, African American women, to have better outcomes in childbirth.
I'm a perinatal community health worker.
Brianna, a mother of two, decided to take action after having a C-section when she had hoped for a natural delivery.
Not even a year later, I happened to hear about Mama Soso Village, and I said, that's what I want to do. I want that type of training.
We provide comprehensive support for women prenatally through postpartum.
Okay, so what about the baby? Baby's looking good?
This is the most active child I've ever had.
The women that we serve, not only are they presenting with clinical issues, so physical health issues, but they're also presenting with social issues, which puts them at a higher risk for mortality.
Brianna recognizes that the odds are stacked against women of color in general when dealing with maternal mortality.
I mean, the statistics don't lie. You know, we can look at different factors, poverty, homelessness, food insecurity, things of that nature, but upper middle class Black women, they have the same outcomes as Black women who are in poverty. A mom will go in and say, I'm concerned about this issue, and their concerns are dismissed or diminished.
But today, with Brianna as her midwife to make sure all her needs are met, Fantasia welcomes a new baby.
He's beautiful. It's worth me going out every day and trying to make a difference with even one mom, or in my case, 50 some odd moms a year.
Skilled midwives, better hospital protocols, all pieces of the puzzle being put together by healthcare professionals across the country who are dedicated to the women delivering these miracles every day. What keeps you up at night when you think about the maternal mortality crisis?
It's entirely preventable. When we look at the last half century of healthcare in the United States, we've had tragedies and we've had triumphs. But I think that this is a situation where we can right the ship and do a lot better.
For Nightline, I'm Dr. Jennifer Ashton.
National Geographic Special Edition Single Topic Issue, Future of Medicine, is online on newsstands now.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.